प्रोफेशनल जिनसे हम कनेक्ट हुए वाया सोशल मीडिया, एंड वी जस्ट लव्ड सीइंग द टाइप ऑफ एफर्ट्स जो ये डालते हैं फॉर पेशेंट एजुकेशन एंड अवेयरनेस के लिए। इनका ये एक सिंपल मोटो है कि बहुत सारी बार ही ऐसे होता है कि मोस्ट ऑफ द पेशेंट्स गूगल एंड कम, and then that's the wrong information which is passed. So we don't want that. We want us all the correct information to be conveyed to all lung patients, and that's why even the caring conversation motto is there. So she's a gold medalist, and she's done her MD in respiratory medicine from Padma Shri Dr. D.Y. Patil Medical College, and she's currently working in Vasai Virar area as a pulmonologist and director of Shwas Chest Clinic. So welcome, Dr. Pranali Patil. It's really nice to have you here today with us. A big round of applause for her.
Thank you for the kind introduction.
Thank you, Dr. Pranali. So for everyone else, मैं सिर्फ एक रिक्वेस्ट करूंगी कि आपके ऑडियोज फिलहाल के लिए म्यूट रखिए. Keep your videos on. We would like to see your lovely faces while Dr. Pranali is discussing and giving you tips about how to celebrate Diwali in a healthier way. Whatever questions, आपके जो queries है आप chat box में डाल सकते हैं या फिर afterwards you can ask. No problem in that. Okay? All over to you, Dr. Pranali.
Thank you so much. I'll share my screen. Just tell me once it's visible, okay?
Yes, sure.
Is it visible?
It is visible. Perfect.
Yeah. All right. So hello, good evening, everyone. That's so kind and nice of you to join to know about your how to take care of your lungs during Diwali. बहुत ज़्यादा awareness lung problems का नहीं है. So to create that awareness, caring conversation is helpful, not just only for lungs, but other disease aspects as well. So same motto that we had and same motto that we have regarding conveying extra information जो कंसल्टिंग रूम में वी कैनॉट प्रोवाइड और ड्यू टू लैक ऑफ टाइम शायद प्रोवाइड नहीं किया जाता या एट टाइम्स व्हाट हैपेंस यू फॉरगेट योर ओन क्वेश्चन दैट यू गॉट टू आस्क योर डॉक्टर. तो कभी कभी हमसे कुछ रह जाता है, कभी कभी आपसे कुछ पूछना रह जाता है. सो let's hope that we cover it slow and steadily about Diwali at least, and let's move on ahead with our topic of discussion. So how do we take care of our lungs during Diwali? So why are we focusing on Diwali? कितना special क्यों है? Why it's important? Why are we hyping it so much? So Diwali comes, festival of light तो है ही, but Diwali comes at such a point of time जब seasonal transition बहुत ज्यादा होता है, बहुत ज्यादा season variation होता है. In 1 month entirely we see most of the seasons. Last year तक बारिश भी हो रहा था. So regarding that, बारिश होने के बाद ह्यूमिडिटी कम कम होते जाता है, एंड बिकॉज ऑफ दैट जो अपने घर से लेके हम शुरू करते हैं. व्हाई व्हाई वी हैव अ रिचुअल ऑफ क्लीनिंग ड्यूरिंग दिवाली. It's not just something that our ancestor told us to do, that's why we are doing it. It's not related to like that. It's not like that. जो ह्यूमिडिटी की वजह से घर में वी गेट डस्ट एक्यूमुलेशन, जो भी सेडिमेंटेशन होता है डस्ट का, सम डैम्पनेस होता है घर में. बिकॉज ऑफ द डैम्पनेस उस पर डस्ट चिपक जाता है, फंगस ग्रो होता है, एंड बिकॉज ऑफ ऑल दिस थिंग्स वी गेट आर ट्रिगर्स इन आर हाउस इटसेल्फ. तो दिवाली के टाइम पे वी क्लीन इट थरली एंड डीपली. तो डीक्लटर तो होता ही है, उसके साथ साथ क्लीनलीनेस की वजह से जो डैम्पनेस एंड जो वेटनेस वो मिट्टी को या फिर हाउस डस्ट माइट्स को, इट्स एरिया फॉर इंसेक्ट, हाउस होल्ड इंसेक्ट टू ग्रो प्रॉपरली. तो उन लोग का भी रिप्रोडक्शन उस टाइम पे हो जाता है. तो वो सब की वजह से अपने ट्रिगर्स आर मोर इन दैट टाइम, और वो ट्रांजिशन होते हैं जब डैम्पनेस चला जाता है. ऑल दिस थिंग स्टार्ट शेडिंग डाउन स्लोली स्टेडीली. हम आंखों से देख भी नहीं पाते हैं कि वी आर देयर इज फंगस और डस्ट एक्यूमुलेशन ऑन डैम्प वॉल्स. तो ये सब ट्रिगर धीरे धीरे करके हमको परेशान करने लगता है, एंड स्लोली जब डैम्पनेस धीरे धीरे कम होता है, ह्यूमिडिटी कम होती है, हवा में ड्राइनेस बढ़ने लगता है, हवा फ्लो होने लगती है, ब्रीज होने लगता है, तभी वो हवा में उड़ करके स्टार्ट इरिटेटिंग अस. दैट इज वाई सीजन ट्रांजिशन के टाइम पे, अक्टूबर नवंबर के टाइम पे, वी गेट अ लॉट ऑफ अपर रेस्पिरेटरी ट्रैक इन्फेक्शन पेशेंट, lot of patients with asthma, COPD, ILD who are coming with an exacerbation. Not just that, new infection, new sensitization, new inflammation भी होता है. So this is the entire background that why we clean during Diwali. And declutter और वास्तु and everything उसके और भी aspects है, but we won't be discussing today. We'll stay true to our topic. Okay. So Diwali is a festival of light. It's most celebrated festival. बट लंग पेशेंट के लिए ये चैलेंजिंग क्यों होता है? तो मैंने सिर्फ घर से शुरुआत किया, घर के ट्रिगर्स के बारे में हमने डिस्कस किया. बट व्हाट हैपेंस इन द आउटसाइड, व्हाट हैपेंस इन द एनवायरनमेंट? तो एनवायरनमेंट में भी ह्यूमिडिटी कम होती है, ड्राइनेस होता है, एयर डेंसिटी जो है वो बढ़ने लगती है. एंड बिकॉज ऑफ दैट मॉर्निंग में कोहरा होता है, नाइट में कोहरा होता है, एंड डे टाइम में जो पोल्यूटिंग ट्रैवलिंग होता रहता है, पोल्यूशन उड़ता रहता है, एंड दैट गेट्स ट्रैप्ड समवेयर. एंड द एयर डेंसिटी एंड आवर लंग्स गेटिंग अडेप्टेड टू दिस, वो उसमें थोड़ा कॉम्प्रोमाइज होता है, चैलेंजेस हो जाते हैं. If you are regular with your medication, you are regular with your follow-ups, you are regular with your checkups, then your doctors come to know by your lung capacity, lung function testing, they come to know, उनको पता चलता है कि how your lungs are working properly. On that basis they give you follow-ups. But अगर medicines proper नहीं है, checkups regular नहीं है, then you are exposed to such triggers, household trigger भी और environmental trigger भी. जबकि हम पोल्यूशन की बात करते हैं, फेस्टिवल ऑफ लाइट्स में हम ज्यादा पटाखे जलाते हैं, बहुत ज्यादा रोशनी करते हैं, एंड कभी कभी कुछ एरिया में बर्न भी किया जाता है, कुछ वुड्स वगैरह, ड्राइड लीफ वुड्स, वो भी बर्न करके दे सेलिब्रेट डिफरेंट वे. बिकॉज इंडिया में हर कोने नुक्कड़ पे जो है ट्रेडिशंस और रिचुअल्स बदलते जाते हैं लैंग्वेज के साथ साथ. सो सिमिलरली, बिकॉज ऑफ ऑल दिस थिंग एड्स अप टू द पोल्यूशन, एड अप होने की वजह से यू गेट मोर ट्रिगर्स एंड मोर इन्फ्लेमेटरी एजेंट्स दैट आर अवेलेबल इन द एयर फॉर यू. सो द एयर क्वालिटी डिटेरियोरेट्स रैपिडली. बट अलॉन्ग विद द चेंजिंग डायनामिक्स, एयर सीजन ट्रांजिशन को भी ध्यान देना जरूरी है. ऑल वी हियर इज अबाउट पटाखा एंड व्हीकुलर पोल्यूशन, इंडस्ट्रियल पोल्यूशन, बट सीजन चेंज को भी ध्यान में रखना इज वेरी इंपॉर्टेंट. This is not just about respiratory patients. 3 years से we are seeing this common factor during in patients who suffered mild to moderate and even severe symptoms during COVID-19. So because of COVID-19, sudden inflammation हो जाता है एयरवे में. तो एयरवे का इन्फ्लेमेशन अगर प्रॉपर ट्रीटमेंट, फॉलोअप्स और रेगुलर चेकअप से उसको सेडिमेंट सबसाइड नहीं किया गया, उसको कंट्रोल नहीं किया गया, देन व्हाट हैपेंस, देयर इज अ रेडीमेड इन्फ्लेमेटरी बेड अवेलेबल, जिसको थोड़ा ट्रिगर मिलने से भी इट अफेक्ट्स योर well-being, it affects your lungs, and because of which you can get symptoms. जो पटाखे हम जलाते हैं उसमें टॉक्सिक फ्यूम्स होता है, उसकी वजह से पार्टिकुलेट मैटर का जो डेंसिटी होता है दैट इज परमिसिबल की रेंज से थोड़ा आगे निकल जाता है, एंड बिकॉज ऑफ दैट इट हैज डेट्रीमेंटल इफेक्ट ऑन पेशेंट्स विद क्रॉनिक एयरवे डिसऑर्डर. सो दिस आर आवर फेवरेट सिंस चाइल्डहुड, ये हमारे फेवरेट आर्टिकल्स है. All of this since we have been lighting regularly. Our grandparents, parents used to tell us to be careful, not put your face directly towards it while lighting it. Just stand a bit away from it, or just turn your face away from it and while you light it. So उसके उस इंस्ट्रक्शन के पीछे भी लॉजिक होता था. सडन धुएं का फवारा जो निकलता था, दैट कैन कॉज ट्रिगर्स, and that powder that is there in these firecracker contains very triggerful, very irritating agents that can cause trigger in your airways, swelling in your airways, and can follow entire inflammatory cascade. जैसे कि कॉपर होता है, लेड होता है, कैडमियम, मैग्नीशियम, और इनका एक्सप्लोसिव कॉम्बिनेशन होता है. साथ साथ उसके साथ में वो सुतली बॉम्ब में सुतल होती है. फिर देन यू हैव कार्डबोर्ड्स. वी डोंट इवन नो वो कार्डबोर्ड्स कहाँ से आते हैं, कौन से प्लास्टिक, कौन से व्हाट डू यू से कौन से कागज से बने हुए होते हैं, कहाँ से वो यूज किया होता है. एट टाइम्स दिस स्मेल सो बैड. इवन दैट हैज further more ingredient that can complicate your lung health and respiratory problems. So simple एक पटाखा जलाने से we are seeing here कितना ज्यादा धुआं हुआ है. एक पटाखा से इतना ज्यादा धुआं, then we can't see things properly until it settles down. And if you have noticed, Diwali other than normal duration, say February March के बाद sedimentation जल्दी होता है. But during this air, during say October, November, December, the air transition happens such a way that धुआं fog जो भी है fast settle नहीं होता है. There is a logic behind that. So this crack, it can give rise to new infection, like I said. So common symptoms that happen because of such triggers are all of you have experienced and we know it, but we'll still discuss it. Like coughing, wheezing, tightness in the chest, shortness of breath, runny nose, burning sensation in the eyes, and feeling a lot of breathlessness. So basically, we have seen this kind of things also, that when a patient does not have any symptoms and signs, asthma is under control. But suddenly after Diwali, because such triggers are there, and if you light crackers or if you just travel in that atmosphere, see you are being eco-friendly. You are not burning the crackers. You are not using anything that is causing harm to the environment, but you are just taking a stroll on Diwali evening, or you're taking a morning walk during Diwali morning. You're just meeting your friends, you're visiting your relatives. In that air, you're passing it by, but you are going to inhale this composition, that polluting air that is there. So you are going to fall prey to that environment, despite you yourself being eco-friendly. So how do you protect yourself from that? COVID-19 has taught us a nice way, and we'll discuss it further, that how you protect when you are being eco-friendly from the pollution of firecracker season change and other pollution that is existing already. So what should you do to overcome the air pollution? See, this advice of mine won't be appreciated by you. Like I just said, that we like to go out, meet our friends and family, wish them on Diwali. So keeping indoor is kind of difficult, but try to stay indoor as much as possible to avoid the pollution. Some say that lighting diyas indoor can also cause some pollution, because the oil that we get these days is not so pure. So use bare minimum oil just for the sake of doing the rituals, and let it be. Don't keep on filling and refilling the diyas like it used to be, like our rituals taught us, like our traditions are. So that should help you. There are a lot of different variants of lights are there. Some get so heated up that they burst in between. So you should stick to LED lights that do not emit any small particulates. They can be used as sustainable light source. So use terracotta lamps to illuminate your homes, as they are eco-friendly. Terracotta lamps के लिए there is one thing, I had to Google it, what terracotta lamps are, because we often don't call them that. What we call that, you will come to know in next slide. However, accessing lightning, बड़े चाव से हम लगाते हैं डेकोरेशन, लाइटनिंग और एवरीथिंग, बट ओवरडू करने से भी लाइट पोल्यूशन होता है. Before Diwali, even if you step out your house and look in the sky, you won't even see any stars. It's not because of the pollution only, the light pollution also contributes. तो हम शांति से तारे भी नहीं देख पाते. So we have to do something about it. दिवाली में जितना रिक्वायर्ड है उतना ही लाइटिंग हम करते हैं, तो that should help us to avoid light pollution as well. So terracotta lamp I was discussing. Terracotta lamps are nothing but our usual diyas made from our मिट्टी का दिया जो होता है वो है. So stick to this mitti ka diya with minimum, decoration on it, or oil paints on it, because the combination of oil paints and the they have a different texture with this diya. So even this diya, if you light it inside, it is going to cause some more pollution. It is going to give out leads and other chemical ingredients from this oil paint. So this is going to harm you. It's going to create some triggers, indoor triggers, whether or you are going to put it in the environment. So try to avoid these kind of diyas and stick to our original matti ka diya, जो एक बार हाथ से गिर जाए. So we have to buy new ones in our next Diwali. But stick to those. They are very helpful. Green crackers. I thought it was a myth. Every year I go out and ask for green crackers for my son to light. But I always heard that ऐसा कुछ नहीं होता है, ऐसा कुछ नहीं होता है. So far, in India, we face resistance to everything that is new. So if we keep on asking कि हमको यही चाहिए, यही दो, and not compromise on it, so maybe one day all crackers can be eco-friendly crackers. So eco-friendly crackers have less polluting agents. They try to use the dried leaf, and they try to use this even some whatever the leftover is there outside mandirs and everything. They try, these people, good NGOs go out and try to collect it, dry it out, and then put it in the cracker. So such a wonderful thought has been put by so many people, and they're trying to make it environment friendly. So I think we should contribute into it. And some put some ingredients also. They are useful for cleaning the air. That helps in cleaning the air. So everywhere if we go, and in our local areas as well, we have to request them to bring the eco-friendly or green crackers. I thankfully, while doing little bit of research for this article, I found that of evidence of some company selling eco-friendly and green firecrackers. So the study has been conducted by the NGOs who are behind this, producing these firecrackers and everything. So they came to know that by lighting these kind of crackers, the particulate matter in the air and harmful gases reduces by 30 to 40%, which are huge in number. So we get to keep our tradition as well, and we get to be eco-friendly as well. So it's a win-win situation. So air conditioner helps in this environment, because air condition naturally dries the air in the our atmosphere, the area that we are sitting or sharing. So because of that, the particulate emission जो होता है वो trap नहीं होता है, वो sediment हो जाता है फटाक से. And now these days air condition are accompanied with certain degree of air purifiers in it. So that also helps. So we have to avoid areas, like I just said, to where they're actually bursting the firecrackers. We have to be conscious and avoid breathing through mouth while passing through unavoidable reasons. You have to go somewhere. You are stepping out in the environment where people are surrounding, where people are bursting crackers. So you should avoid breathing through your mouth and taking deep breaths. So normal tidal breathing is okay, and you should not, just because you want to get over that polluted area faster, वो cover fast करना है, इसके लिए आपको जल्दी जल्दी सांस लेके भाग भाग के जाने की जरूरत नहीं है. जब आप भागा दौड़ी करोगे, भागोगे, घाई करोगे, रश करोगे, बिकॉज ऑफ विच आपका रेस्पिरेटरी रेट बढ़ेगा. एंड ऑन द कॉन्ट्ररी ऑफ व्हाट यू आर ट्राइंग टू डू, वो अपोजिट हो जाएगा कि यू विल ट्राई टू inhale more polluted air, rapid or more polluted air. So that will cause a detrimental effect on your lung condition. So normal चल के जाना है, आराम से चल के जाना है, and it will be best if you cover your face with a face mask, and preferably N95 ones, because जो कवर आपको मिलता है N95 मास्क से, that is not necessarily you will get by covering your mouth with handkerchief or masks, simple surgical mask. But agar it's not available for you, then at least something would be better than nothing. So it will be ideal to cover your face with good layer of cloths and walking slowly through it. That should help you. Air purifier can be kept in the area जहाँ से air ventilation आपका हो रहा है. So that should help you out with the reducing pollutant, toxin and allergen from the indoor air. This is a wonderful picture I came across while searching for something to put on my PPT. These are eco-friendly firecracker sellers who themselves are wearing masks. Such a wonderful message. I don't know if it was taken during COVID-19, it's because of that or what, but it's a good message that they are selling that green crackers only, and they themselves are wearing the mask while selling the firecracker, which are eco-friendly. So it means they are aware. It means they know they need to be protected, and they're taking care of themselves. And if they're selling it with the mask, with while wearing a mask, तो सामने वाला लेने वाला भी will be aware and will be conscious कि हाँ बाबा, even despite we are taking the green crackers, we should be taking extra efforts. We should be taking a step forward and we should be taking care to wear a mask. So little things also convey big messages over here. Those who are suffering from lung condition should have their emergency medications like rescue inhaler, regular inhalers, nebulizers, and other medical equipments handy. And make sure that you take them regularly as well. So those who suffer from asthma or respiratory illness should always carry a rescue inhaler. Nowadays, what we tell is the smart therapy, single inhaler and the single rescue inhaler. In addition, they must consume nutritious diet with plenty of fruits, vegetables, and water to prevent hyperacidity. This is a very important point because Diwali hai, so we make new kind of dishes, delicacies, sweets, and fried things, fatty things. We try to drink cold drinks because that's what's been promoted to us while we watch TV. Ki pizza khao, cold drink pio, that is how you celebrate Diwali. But that's not the way. I think I would request you all to stick to your traditions. जो हमारे जनरेशन से चलता आया है, that is been healthy, that is been told to us in a healthy way, how to live yourself in healthy way. Definitely हमको आज के लाइफस्टाइल से वो उसको मॉडिफाई करना है, उसको डेफिनेटली उसको असेंबल करना है, बट विद द गाइडेंस ऑफ आवर एल्डर्स वी कैन हैव दैट. Eating outside food, eating fatty food, eating processed food is not the way to celebrate Diwali, definitely. So, घर का जो भी है, if you have cooked, you can definitely have, but still we would request you not to go with the cold things or chilled rabdis and all these fancy things. I would request you to have simple sweets that you easily digest and not a lot of it. Just the basic minimum if you're not diabetic. If you are, then please ask your diabetologist what all you can have. And there is one bonus point that every one of us wants to hear, that exercise should be avoided during Diwali as it can result in lung infections or exacerbation of condition as the smoke or smog is inhaled deeply. So this is a good thing when we hear that you don't have to exercise. But wo 4 दिन when we don't do exercise, we try to miss it, or rather we usually miss it. So this is like I told you earlier also कि लॉजिक क्या है. जब हम घाई करते हैं, रश करते हैं, वी ट्राई टू वॉक हरीडली समवेयर, फास्ट जाने की जरूरत, फास्ट स्पीड से जाने की कोशिश करते हैं, तो हमारा रेस्पिरेटरी रेट बढ़ जाता है, हमारे श्वसन का रेट बढ़ जाता है और इनहेल एक्सेल बढ़ जाता है. उसकी वजह से हम ज्यादा कंज्यूम करते हैं हवा, और ज्यादा पोल्यूटेड हवा अगर हम कंज्यूम करें तो वो हमारे लंग्स में प्रॉब्लम है. So this is the reason you can avoid doing exercise in open air when you know that area is polluted, environment is polluted. So how should be nutrition during Diwali for your lungs? First of all, you should be hydrated because as we know, 70% of our breath contains our breath contains water. तो ह्यूमिडिटी अपना जब हम सांस छोड़ते हैं वो गर्म लगता है, बिकॉज हमारे सांस में से पानी की भाप भी निकलती है साथ में. सो सिर्फ पसीना ही नहीं है जो हमको डिहाइड्रेट करता है, नॉर्मल सांस लेने से भी हम डिहाइड्रेट होते हैं. सो वी हैव टू पे अटेंशन एंड हैव अ रेगुलर इनटेक ऑफ वाटर, प्रॉपर इनटेक. आपकी कंडीशन के हिसाब से, आपके बॉडी रिक्वायरमेंट के हिसाब से you should be drinking water. Normally what we say is 16 to 18 glass of 200 ml is required, but if you have lung condition, heart condition or kidney condition, then you are supposed to discuss it with your doctor and set your hydration limit for the same. Hydration is not just only important for feeling energized and fresh. It is important for your body to be able to transport the nutrition. जो हम खाते हैं पीते हैं उसको ट्रांसपोर्टेशन करने के लिए जो ब्लड से ट्रांसपोर्ट किया जाता है उसके लिए यू नीड टू हैव एडिक्वेट वाटर इन इट इन योर बॉडी सो वो इजीली ट्रांसपोर्ट होगा और हर जगह डिस्ट्रीब्यूट होगा देन यू विल हैव लेस प्रॉब्लम विथ न्यूट्रिशन डेफिशिएंसी फ्रूट्स वेजिटेबल्स खानी चाहिए fresh fruits and vegetables are loaded with vitamin C carotenoids which are converted into vitamin A in the body. Vitamin A is very essential to develop and maintain your immunity. Vitamin C is most abundant in antioxidant and present in the extracellular fluid lining of the lung and has free radical scavenging property. Why is it important to have this free radical scavenging property? जो हम सांस लेते हैं ऑक्सीजन लेते हैं तो ऑक्सीजन का सिर्फ एक ही हिस्सा हम यूज करते हैं उसके बाकी हिस्से जो है वो फ्री रेडिकल करके बॉडी में छूट जाते हैं तो वो फ्री रेडिकल नॉट नेसेसरीली हमारे बॉडी के लिए अच्छा काम करते हैं वो हमारे बॉडी के लिए टॉक्सिक भी हो सकते हैं एंड दैट इज द रीजन वी एज oxygen is the reason that we survive and it is the reason that we age because of the free radicals so flavonoids such as quercetin is also have antioxidant property फाइबर रिच डाइट होना चाहिए फाइबर रिच डाइट मतलब अपना घर का एवरीथिंग दैट वी हैव रूटीन फ्रूट हाई फाइबर लेटेस्ट नया वाला जो आया है that is quinoa seeds chia seeds brown rice oats everything but I would say stick to your roots stick to your traditions and stick to your परंपरा से चलते आ रहे जो आपका फूड है न्यूट्रिशन है यू शुड स्टिक टू इट एंड मॉडिफाई इट एज पर योर हेल्थ कंडीशन बाय डिस्कसिंग इट विद योर डॉक्टर्स एंड योर डाइटिशियंस एंटीऑक्सीडेंट रिच डाइट जैसे कि फ्लेवोनॉइड जो कि रेड और ब्लू कलर्स के फ्रूट्स में पाया जाता है जैसे कि स्ट्रॉबेरीज ब्लूबेरीज दे हेल्प लंग्स बिकम स्ट्रॉन्ग बाय देयर एंटीऑक्सीडेंट इफेक्ट एंटी म्यूटाजेनिक इफेक्ट एंटी प्रोलिफरेटिव एंड एंटी इंफ्लेमेटरी एक्शन टोमेटोज में लाइकोपीन होता है दैट हेल्प्स इन रिड्यूसिंग स्पूटम न्यूट्रोफिल एंड इलास्टिस एक्टिविटी वो क्यों काम में आता है कि लाइकोपीन की वजह से म्यूकस प्रोडक्शन का जो कंसिस्टेंसी होता है वो बदल जाता है दैट इज व्हाई इट इज इम्पोर्टेंट green vegetables again I have given here two options on the left side we see our traditional Indian green leafy vegetables and on the right side we have our modern trendy green leafy vegetables आपका जो भी preference है you stick by it but you don't have to give in to you the modern diets and start doing that and forgetting what your tradition has been forgetting what your old recipes that you have been eating since your childhood so that is important sticking to your roots is very important so that's about it any other questions I would like to answer so we have discussed how what can affect to your lungs how it affects your overall health and what food you should be eating what you should be doing to avoid uh, getting triggered by your condition many patients are like that who are very regular with their inhalers very regular with their medication very regular with their checkup still they get triggered by it why such thing happen like I said before the pollution increases drastically the air quality changes as per the season and the contributory effect of pollution that has been created by the firecracking it's इसके एकत्रित परिणाम की वजह से you get that trigger and as you are aging as you are trying to adapt lungs also get set back at point of time कभी कभी होता है ना ज्यादा हो गया है so they need time to heal they need time to recover they try to adapt rapidly और नहीं हो पाया then they give in and they just take a step back let it heal and then that is the time you need help of your doctor to ease your symptoms so that's about it. Thank you so much for listening patiently, and we are open for the questions. Dr. Mrunmayee, over to you.
Thank you, Dr. Pranali. Dr. Pranali, can you please stop sharing the content? Then we can
Yeah, I'll do that.
Uh, So, quite a good insights that you gave. Definitely, I am sure most of them have queries about it. काफी सारे अच्छे अच्छे tips मिले. Certain tips I'm sure the patients would be most happy was not to exercise during Diwali.
Yeah.
And that's the reason even we give Diwali off for all our patients that you shouldn't have exercise, you should celebrate Diwali very well. Very interesting top points that I felt were about green crackers and terracotta diyas as well. So thanks a lot, Dr. Pranali, for sharing all these insights. It was beautifully explained by you.